afternoon, good morning to all of you. Welcome to this exciting webinar on a sustainable HIV response towards 2030 and beyond. I'm Christine Stechling. I'm the Deputy Executive Director here at Unaids for Policy, Advocacy and Knowledge. And I will just introduce the webinar, and then I will moderate the first panel, and then Anjali Ashrikar, who is also here, and you can see who is the other Deputy Executive Director responsible for programs, will facilitate the other panel and also will close us out. So let me just say a few words before we start. We're really excited to have you all here to have a conversation about this critical work that many of us have been doing in some way or the other over many years. Really thinking about how to ensure that we sustain the enormous and exceptional gains that we've made in the global AIDS response in the years to come. An important aspect of this is to strategically think about the different pathways that countries are on as their epidemics are moving or have already moved from an emergency response to a more sustained response. So some of the questions that we're asking ourselves here is, what does that mean for ensuring that we safeguard the many exceptional aspects that we have established in the AIDS response, such as the real commitment to human rights protections as part of health programming and as part of HIV programming, not only to overcome the stigma and discrimination that is so often associated with HIV, but also to ensure access to medicines and health products across geographies and across economies. How do we ensure that we even further strengthen community systems as part of health systems as we're starting to integrate HIV into broader health systems and into broader health programs? And how do we keep the political momentum alive that has been critical in driving successful HIV responses, both at national but also at global level? In short, and to set the scene here, we must collectively think through the different aspects of sustainability as we're moving towards 2030 and towards our goal, our overall goal of reaching or ending AIDS as a public health threat. These aspects include programmatic, they include political, and they also include financial aspects. We are undeniably in a situation where funding for health and for development at large is under a lot of pressure, and that often characterizes how we're having conversations about sustainability. But we may want to go back to our roots as the AIDS movement, as I often reflect on. And then when we all started, it wasn't about what resources were available, but it was about the needs. What needs are there in communities and in countries that we need to respond to? And it's in the spirit of leveraging what we have and listening to countries and to communities that will help us to think about political, programmatic, and financial sustainability and the necessary transformations that we will need to see to reach a long-term sustainable future of quality HIV programming. And that is why we're so excited to have you all here at this webinar and excited about this joint work that we're doing together with the Global Fund and with Pepfar to address some of these pertinent questions. So let's start with our first panel, where we will have a unique opportunity to hear from the leadership of Unaids, of Pepfar, and of the Global Fund about this new collaboration between the three institutions to support countries on their path to sustainability. And later in the second panel, so we will have a few reflections from each one of their three leaders coming from the three institutions. We'll have a question and answer session. We hope to have a bit of a conversation. And then we will have a second panel, which Anjali will lead on, where we will hear from other key partners, including from national authorities, from civil society actors, from people living with HIV and other global partners. So with all of that said, let me now turn first to Winnie to give us a few reflections to start us off. Winnie, over to you.
Thank you, Christine. I'm delighted to be here with all of you, especially my colleagues, Peter Sands, and Becky standing in for Ambassador Nkenga's song. 2030 is fast approaching. Let's be clear at the outset that ending AIDS as a public health threat by 2030, the goal, does not mean the end of responding to HIV. Post-2030, tens of millions of people will still need to be on lifelong life-saving treatment. Right now, in the absence of a vaccine and a cure, we need to find and put on treatment over 9 million people living with HIV globally. We will still need to avert millions of new infections and build health and social systems that support the broad range of services needed. And to do this, we must sustain the global response, country responses at a political level, programmatic level, and financial level. I'll keep my remarks brief. I want to focus on the current context and why sustainability now, what's needed, and how Unaids, together with partners, can support the leadership of communities and countries. We're looking at a very different and changing development context. Changing world. We're facing major shocks and multiple crises. We have a broken global financial architecture that doesn't provide the necessary safety nets for developing countries against all these shocks. Countries are struggling to increase domestic resources for health and HIV. Many of them are failing. Debt repayments are on the rise, consuming 3 times more resources in Africa than health investments. The international financial architecture isn't able to provide a solution to this debt crisis so that countries can then pay for health, for pandemics, for HIV. So the HIV response in low-income countries remains largely dependent on external funding, mainly from Pepfar and Global Fund. But
it needs
hello?
perseverance. First of all, it needs long view.
Sorry, Winnie, I think you can continue. I think somebody's mic was unmuted. There you go. You're on mute, Winnie.
Sorry, I'm muted by the host. I hadn't seen it.
Okay, sorry.
So to sustain the gains, we will require concerted efforts to craft and commit to long-term strategies that are sustainable into the future. We must put our focus beyond 2030 because 2030 will be the beginning of yet another stage in the fight against the HIV, a different stage. With countries' leadership and close collaboration of partners and communities, we must seek to transform the current HIV response so that by the time we get to 2030, it is a transformed response able to keep people alive beyond 2030. So we must find solutions for local production, effective procurement, IP rules that allow affordable prices of medicines and ART. We must work on finding solutions for integration of HIV programs into stronger health systems and building solid universal health coverage, primary healthcare systems that are fully integrating HIV services. We cannot end AIDS and sustain the impact of the HIV response without an enabling environment that supports the services, the delivery of services and the uptake of them. Human rights, therefore, must remain central to the HIV response, and communities must continue to play the critical role they play where we see success. So this requires ensuring equity, eliminating stigma and discrimination, and removing other key constraints such as gender-based violence, racial, economic, and education inequalities, harmful laws and practices, limited access to justice. These environment issues, what we call enabling environment issues, have the work on them must increase. Earlier this year, Unaids launched what we call a new approach to HIV response sustainability. We're doing this in partnership with others, Global Fund, Pepfar, and countries. The focus is on the transformations that are needed to the current responses so that we maximize impact towards 2030 and then also reshape the response for longer term sustainability beyond 2030. We are focusing on supporting countries to lead the development of HIV sustainability roadmaps that will set a path for the HIV response into that future. So that as the epidemic evolves and targets are achieved and we get closer, we also evolve and make the systems and service, adapt the systems and services for that changing response. We need strong political leadership in this regard at the country level, but also in regional bodies and at the global level. So we also talk about sustaining political will. That is also a job to be done, keeping the issue alive at the political level, at country, at regional, and at global level. It's a call for, there is a clear call to action for countries and communities. It's a call for government officials beyond health, international development partners, and us, the joint program, to be creative and innovative. How do we sustain this response politically? What transformations do we need to make programmatically? And how do we spur resources, both from the donor community, but also domestic resources? How do we support the increase of domestic resources towards health and towards HIV? There's the challenge. Everyone needs to be ready to change and adjust the way we have been implementing the HIV response and put the global response, country responses on a sustainable path. I'll stop here. We are opening a very important dialogue that we must sustain into the future. Many questions, we don't have the answers to them, but together we will be able to find the answers and support the countries towards sustainable responses. Thank you. I'll stop here and look forward to hearing Peter and Becky and others. Thank you.
Thank you, Winnie. And also already telling us that there are questions that we will not be able to answer in the questions and answers session, but it's about thinking collectively about some of these really big issues that are before us. So thank you. I will hand over to Peter Sands now, the Executive Director of the Global Fund to fight TB, HIV, and malaria, and to hear some of your reflections, Peter. And so that, and you know, kind of going around first the Unaids Global Fund, and then we will round up with Mamadi from Pepfar, which makes the group of the three institutions that that are together in this work around sustainability and transforming our AIDS response in a sustainable manner. Winnie, if you could go on mute, that would be great.
Sure.
And I hand over to Peter now. Thanks, Peter.
Thanks, Christine. And look, it's great to take part on this. Two overarching comments. One is it's a mark of the success of the global response to HIV/AIDS that we are even having a conversation about sustainability and progress towards actually the successful achievement of the ambition of ending HIV as a public health threat. The second overarching comment is that I think this collaborative effort of working as the three institutions, Unaids, Pepfar, and the Global Fund, with our partners in countries to come up with sustainability roadmaps that are country-owned and fully worked through is really, really important. We cannot count on the external support for HIV being sustainable at the levels that it is at the moment, and therefore we need to be thinking hard about how sustainability will be achieved in other ways. My starting point on this is that there isn't a simple answer here. The nature of the HIV/AIDS epidemic in different countries is very distinctive. It isn't the same in every place, as we all know. And also the progress that countries have made towards epidemic control is very different in different places. The second dimension on which countries differ is on the financial ability to take on more of the burden of the response. In some countries, it's primarily a question of political will and prioritization. The money exists, but it's not politically prioritized, HIV/AIDS. In other countries, it's more of a question that there simply isn't any money. And that obviously poses a very different nature of challenge from the point of view of sustainability. In all of this, what we should be thinking about, though, is not just more money, but of course, more health for the money. But let me start by talking about the more money side of it. Too many countries are still too reliant on external sources, primarily Pepfar and the Global Fund, for most of the funding of their global HIV response. And because of the long-term nature of this and the increasing pressure on donor budgets and the competing demands for funding different sorts of global health need, we need to reduce that dependence. And that requires tackling the questions where there is a political will problem and the more difficult but still important questions around building long-term financial stability, integrating HIV/AIDS programs into an overall plan for funding UHC, for funding primary healthcare, whether that's through taxation or national health insurance schemes, and so on. In doing this, we should recognize that when the so-called sort of domestic resource mobilization is actually financed by concessional lending from development banks, that is a step towards true sustainability, but it isn't really a full achievement of true sustainability, because it is effectively still relying on ODA, but through the modality of a development bank rather than a grant-based organization. And I think one prerequisite for us working with countries effectively here on these issues is real clarity on what the flows of funds are, both the flows of funds domestically and the flows of funds from external sources. In mobilizing extra resources from domestic sources and tackling the issues of sort of political prioritization around funding the HIV/AIDS response, I think we have to get much sharper and assertive about the economics of it. HIV/AIDS, every new infection of HIV/AIDS is a tragedy for the individual and for their families and friends, even though it is something that we can now turn into a chronic condition through antiretroviral treatment. But it is also, from the point of view of the country, every new infection represents a 50, 60-year, depending on the age of the person, financial liability. A financial liability that many countries are currently shielded from by the Global Fund or by Pepfar, but which ultimately will have to be borne by the country. And I think we need to be making clear to finance ministers that the return on investment in prevention is incredibly high, because otherwise you are, as I say, taking on this long-term financial liability. There are a set of things we can do around the mobilization of more money. And part of that, I think, is going to be to drive more money away from the countries that could afford it, but have chosen not to, towards those that truly can't. The more health for the money aspect, though, is equally important. When you look at HIV/AIDS programs across the world, the reality is that there are some very significant differences in the cost effectiveness, the quality with which programs are being implemented. And there is a big prize to ensuring that those which are less effectively implemented get up to the efficacy of those which are in the top quartile or so. As part of that exercise of getting greater efficacy, we do have to think, and the answers here again depend very much on the context within countries, about greater integration of HIV/AIDS programming into broader primary healthcare programming, whether it's around sexual and reproductive health, or maternal care, or other forms, other sort of packages, people-centered packages of care. Sustainability also isn't just about the money, and sustainability requires policies that enable people to get access to the services they need. One of the things that increases the cost of delivery and reduces the effectiveness of HIV/AIDS programs are increased barriers to care, human rights related, gender related barriers to care that mean that people can't get the services they need, or that they have to be delivered in more expensive ways. We will not have sustainable programs for HIV/AIDS, even with more money, if we simultaneously have moves to reduce the human rights of key populations. That equation just doesn't work. And linked to this, I think we have to be very thoughtful about the fact that sustainability ultimately requires countries to take ownership of both the policies and the financial burdens associated with fighting HIV/AIDS. But when countries take on the burden, it also has to be broader than just the governments. It has to recognize that with HIV/AIDS, communities, civil society play a central and indispensable role in delivering the services that are required and achieving the progress we need. So that shift towards greater country ownership can't be done in a way that actually reduces the space for civil societies or communities, because then we will be, in a sense, advancing some aspects of sustainability at the expense of others, and it's not at all clear that the net impact will be a positive one. So I'll stop here, but I think this is a really important moment to be grappling with this set of issues. It's partly a financial set of issues. We need to ensure that we have more non-external money going towards these programs, but it is equally important that the non-financial aspects of it, the policies, the human rights issues, the gender-related issues, are also dealt with, because they are equally critical to sustained progress against the disease. Back to you, Christine.
Thank you so much, Peter, and thank you for summarizing on a note that brings us back to the non-financial aspect of sustainability, which I'm sure there will be lots of questions also from participants about. And just as a reminder, I've been told to remind all of you who are on the webinar, please put your questions in the question and answer, and not, as I've wrongly informed you, into the chat. And so that our team here can cluster them, so that I can put them to the panelists after. So thank you, Peter. Thank you, Winnie. So I'll hand over to Mamadi Jilla, who is the Deputy Coordinator, Multi-Sector Relations at Pepfar, at the US government. I think many of the people here will know Mamadi. So we're really glad that you could step in, Mamadi, and speak on behalf of Pepfar. And maybe just share a first set of reflections before we have the discussion. Thank you so much and welcome.
Thank you so much. Good morning, good afternoon, and good evening to colleagues from Unaids, from the Global Fund, Pepfar, government ministers, and other leaders and partners on this webinar, observing all protocols. I want to acknowledge you, Winnie. I know you didn't know it was me stepping in, the Executive Director of Unaids, and to thank you and Unaids for co-convening us today. Let me also, with equal enthusiasm, thank Peter. Both Winnie and Peter's remarks were really inspiring, and I'm hoping that the audience also found it that way. The Global Fund has had an enduring partnership with us in the fight against HIV/AIDS, and we wouldn't have made the progress we have made without that investment. As was mentioned by Christine, I'm stepping in to the podium this morning as Ambassador John Nkengasong is not here today, but he will be back to meet with you and support your work and service in countries this fall. I wanted to begin my reflections by just offering a story that I hope folks will be able to connect with. Over the past 2 years here at the State Department, we have embarked on what the ambassador has referenced as a pioneering effort to institutionalize the largest public health effort ever led by a single nation to combat the threat of HIV/AIDS, that is Pepfar, into the Department of State. Last year, as the new Bureau for Global Health Security and Diplomacy was about to open, the former Deputy Secretary of State, Wendy Sherman, said to our small team who worked to establish the Bureau, after 20 years, Pepfar is now being formally institutionalized into the State Department. This will assure this unique and exceptional program continues to thrive, protected by the breadth of the State Department and its assets. So I want to propose, particularly to the family that owns Pepfar, in every part of the globe where this program has come alongside country efforts, Global Fund investments, and the support of the UN joint program that is Unaids, that it is now your turn to institutionalize our program within country systems so that its enormous gains continue to thrive. Unaids, thank you for taking the leadership on all our behalf to develop guidance, to put together the tool that we are calling the country sustainability roadmaps. These roadmaps offer us an instrument to co-create, to dialogue, to document all our talking into actions that move in this direction of institutionalizing the HIV response programs into a country-led approach to HIV response sustainability. Because HIV remains a serious threat, a serious health threat, a security threat, and a developmental threat, we have no cure, we have no vaccine, and we have an endless supply of young people for who the risk remains an enduring threat. We have no choice but to take the road, and there are no smarter people to figure this out than those who have saved millions of lives over these last 22 years. Every country context, as Peter said, is different, but there are a few fundamentals to making this moment mean something. One You are the pioneers of this effort to institutionalize HIV programs, using all the lessons we have learned from what people say they want who are impacted by HIV and AIDS. 2, we have to listen. We have to act as if all our lives depended on getting this right, and we cannot do so without respect for country leadership. 3, determine what role you plan to play in what must be a multi-sectoral approach, so you come to this effort clear on how you can be additive. We call on all our ministers to take us up on that challenge. For this effort to succeed, I would argue those who have followed will need to lead, and leaders will need to be willing to be instructed and directed by others about what makes best sense for them. This sustainability roadmap process will be successful when the countries can claim victory for a quality health delivery system that is durable for its people, that we all help them establish and secure. Let me end by saying that Pepfar is committed to investing in the vision and transformation plans presented in these sustainability roadmaps being developed during our upcoming COP25 planning meetings. I am humbled by this mission of our lifetime, where we saw a health threat threaten to destroy a generation, and we found the operational muscle catalyzed by the United States to save nations so that they could thrive. Now it is this current workforce's turn to make that last, and we can only do so by institutionalizing the programs into country systems. Thank you for your kind attention, Christine, and back to you.
Wonderful. Thank you, Mamadi. And maybe as we have about 10 minutes to have a question and answer session, which we are desperately trying to organize as a conversation, which is always challenging with 430 people on one virtual call. But maybe to start us off, maybe Mamadi, I can go back to you and just ask you maybe 2 interrelated questions. One of them is partly in the chat, I think. As you're preparing for your guidelines for the COP guidelines next year, you know, the hope is that these sustainability roadmaps that we are working on collectively will be helpful in that, how they will inform how the program evolves. So it would be good to give a bit of an insight how you see that these sustainability roadmaps will inform Pepfar programming on the way forward. And at the same time, I think Maureen has asked the question in the chat about how do we make sure that we're not overwhelming countries with these sustainability roadmaps, that there was a bit of a shield with Pepfar and the Global Fund when that work was done here. While we're now really, you know, there's been a lot of talk about country ownership, we're really trying to put it back into country ownership. Maybe you have some reflections on that, Mamadi. One, how do we inform, how does what we are planning and already doing inform your work next year, but also how do we ensure we're not overwhelming countries?
Thank you, Christine. I think one thing I would say is that this is a process, and the expectation is that everything is not going to change overnight. In fact, maybe if you do it too fast, you wouldn't actually get something sustainable to take root. So the first thing I'd like to say is that we want to, you know, we at Pepfar, we have always been focused to make impact. And sometimes that focus can sometimes feel, as you imply, very overwhelming to countries. And I think that it is important that we establish from the outset that we are creating tools to help us move along a trajectory that we expect will not happen overnight and will look different in different places. But it gives us a marker, right, that we are saying we're heading somewhere and we're coming together around a common framework so that everybody is getting visibility into the thinking and into what we're saying should be the first and foremost types of programs that we address. So there are also other folks on the panel here, and I don't want to be the only one speaking on behalf of our team, But I think that our ability to convene and gather around a framework will be very influential in being able to sort of signal kind of where the support, what kind of support is needed, what is being prioritized, and in particular, giving civil society a voice to ensure that what it is we're putting forth is not perceived as something that is exclusive of, that does not include them. And I think that everybody has said that this morning here, that what whole of country is must be inclusive of civil society and of course of the people who these programs benefit the most over.
Thanks, Mamadi. Maybe a question for you, Winnie, and possibly for you, Peter, too. I think I have two more questions here. One is coming back to the question of burden of debt in many countries. Peter, you talked about it. Winnie talked about it. You know, how are we squaring this call for increased domestic resources at a time that so many countries are under so much stress in terms of debt repayment and an architecture, I think, a system that many people believe is not servicing anybody at the moment, or at least not countries themselves. What does that mean for us as we're trying to bring together, call for more domestic investment? I don't know, Winnie, do you want to answer first, and then I go to Peter? You're on mute, Winnie.
Thank you. I think Peter gave us a good outlay of this challenge, this financial challenge. The high burden countries are mostly in sub-Saharan Africa, Eastern Southern Africa, not only, but here mainly. And they also happen to be the countries that are very highly indebted today, and who have been impacted by these rising interest rates and are now paying more to debt repayments at the cost of social services like health. Now, those are the same countries that are also mainly externally dependent for their HIV response, 90% and even over. So the challenge here is, yes, about the debt issue, but it's even more than just the debt issue. On the debt issue, at least us as the United Nations, we've decided to make the question of the reform of the international financial architecture a priority at the Summit of the Future. We don't expect to find a solution to all the challenges in the system, including how credit is accessed, how finance is accessed, but we hope to start the conversations towards that. Sorry, I hear you talking, Christine. Okay, so it's about getting commitment from governments to begin at least a reflection on key aspects of the international financial architecture so that there can be more equitable access to financing, and that will be part of the solution. But then, like Peter said, there are countries with the resources, but not willing to put the resources on responding to HIV. They have other priorities. They don't prioritize people living with HIV or at risk. That's a different set of issue. That's about pushing them to give equal rights, a right to health for everyone, including people living with HIV and at risk. But also, in terms of domestic resource mobilization, there are a host of questions there that need reform. You need to reform the tax system so that actually countries can keep the taxes that are due to them when production is in their countries. There are a lot of loopholes here that countries haven't been able to come together and close. So a reform in the global tax system is also important. But then Peter talked about the effective use of resources, cost effectiveness of the response. I was so amazed. I'm just coming from Cuba, where the HIV response is fully integrated in a very strong primary health care model and across the health system. I don't know the cost per person, but clearly you can see that it is a low cost to them because the services are well integrated. The focus on prevention is so strong. The enabling environment is worked upon. You can see that they've driven their costs down, and reached people. There's so much to learn from that country. They have their challenges, but we do need, as a joint program, to look at how integration is happening in countries and find the best practices and share guidance and success stories so that countries move towards more cost-effective responses. I will stop there because I know Peter has more to say. As someone who leads a big program funding.
Thanks, Winnie. And Peter, maybe because we have spoken quite a lot about the finances, there were quite a number of questions by participants about the argument that, you know, it's a good return on investment if you protect people's human rights and they don't get infected. And it's in the interest of governments to protect human rights. But we also know there are governments that are not, they're exactly not doing that. And so people are asking, what about countries who really do not care about some of those most affected by HIV and therefore will not do the best to include them and invest in them, especially when there are no outside funders? Maybe you can speak to that, and maybe you have some other thoughts to add to Winnie's response to the finance question.
Well, first of all, I like the dynamics of this panel because I come from a banking and finance background, and Winnie is giving really good answers on all the finance stuff, and I get to talk about human rights. But in all seriousness, we have two big challenges when thinking about the sustainability in the next phase of the fight against HIV/AIDS. One is a money problem, and the second one is a human rights, gender equality type problem. And if you actually ask me, I would say the money problem is really hard, but actually more solvable than the human rights and gender equality problem. And that's the one that I'm most worried will derail us. And so we must give it, when we talk about sustainability, we must give it equal focus. Now, I've seen the questions in the chat and the skepticism about whether countries will be convinced by economic arguments and look, to be honest, if there was an easy answer here, we would have found it. I think we have to fight the issues around human rights for key populations, for needing the imperative of continued progress on gender equality. We have to fight it in multiple ways. We have to fight it on a values base, that this is the right thing to do because of a belief in our common humanity. We have to fight it using epidemiological arguments. We have countries who think that much of their epidemic is concentrated in men who have sex with men, who that particular government, as has been suggested by Maureen and others, may not care about. But actually, when you go into the numbers, you will find some of these governments, actually the people who are most likely to be infected are adolescent girls and young women. So making sure the governments actually understand the epidemiology they're confronting is, I think, really important. A third argument is the economic argument. And I have been surprised how many policymakers I've interacted with don't really fully get how expensive it is to have new infections. for a country. And partly that's because they don't have to pay for them in most places at the moment, because the antiretroviral treatment is largely paid for by the Global Fund or Pepfar. So I don't think there's a single answer to how we deal with the barriers to access, the rights issues that confront us. But we absolutely have to be working as a full partnership across all the people who are on this call, all the different agencies, the communities, civil society, governments themselves, to tackle these issues. Because if we don't, there isn't an amount of money that will actually solve and beat HIV/AIDS. In a sense, I don't think there is any example of a country that has managed to really beat HIV/AIDS at the same time as criminalizing men who have sex with men, or heavily stigmatizing transgender populations, or making it difficult for those who inject drugs to access services. One has to address those issues. And I would also stress the structural inequalities that so many women face, unless those are tackled. So yeah, I completely acknowledge the challenges in many parts of the world, but I think we can acknowledge the challenges both on the human rights side and on the money side, but we shouldn't accept those as reasons not for sort of working together to combat them.
Thank you, Peter. I think, I've got lots of follow-up questions to every one of the three of you, but we don't have enough time. But I want to assure people, I think there were also some questions we haven't answered. This is a dialogue we want to have from now onwards with all of us, with the leadership of the three institutions, but with all of you in the room. So this will be not the first and the last conversation we will have. So we take note, and we will continue trying to find ways and platforms to have this. I want to thank our three fabulous speakers, Winnie, Peter, and Mamadi, for starting us off. And I want to ensure that we have enough time handing over to the second fabulous panel, and they have 4 speakers, so Anjali has an even harder job to manage time. So I hand over to Anjali and bring us to the second panel. If we were in a real room and not in a virtual world, we would all give you a round of applause, feel like we're applauding for you. And with that, I hand over to Anjali. Thanks, everyone.
Terrific, thank you. And I think I see all the applause coming virtually, so it's still there. It's great to be with you all today. The leadership across the 3 institutions, Unaids, Global Fund, and Pepfar, I think made very clear 2 key points. 1, we are all committed, and 2, we are all united in this effort to support countries to sustaining the HIV response into the future. They each and together made a clear clarion call to action, that we all must work together to institutionalize, as Mamadi said, this tremendous HIV effort, for the HIV impact to be sustained into the future for the people that are served through it. We have to work together to build a solid future for the HIV response, which will evolve as the epidemic evolves. We have to ask ourselves, what needs to change? What do we do differently? What do we stop doing, and how do we adapt to what's new and what needs to happen for the future? And of course, this varies country by country, as Peter said. Winnie emphasized that we cannot end AIDS and sustain the impact of the HIV response without strong political leadership, commitment, and continued solidarity across all partners, and the deep and full engagement of countries and communities through this. We know that strengthening community support, focusing on people, person-centered care are essential to creating sustainable roadmaps that prioritizes those furthest behind, with a strong human rights-based approach, this is all a path that is essential to end AIDS, but also to sustain the impact into the future. We have an opportunity to be more laser focused on what the data, science, and evidence is telling us, and to ensure that we identify the barriers and blockages holding us back as we transform the response into long-term sustainability that we all desire. So this second panel brings together perspectives from different sectors within the global HIV response. We know that sustaining the HIV response requires the absolute leadership of governments. And today we're privileged to have Dr. Naimi Shupala, a public health expert with a strong track record in service delivery, health systems, and sustainability. She currently serves in Namibia's Ministry of Health and Social Services as the Director of Primary Healthcare Services as well. She's also leading the sustainability roadmap process in her country and is also co-chairing the Unaids Advisory Committee on the HIV Response Sustainability Initiative. Second, we know that sustaining the response also requires strong voices with relevant roles from strong communities all over the globe. And we have one of those critical voices with us today, Florence Anam, who's the co-executive director of GMP+. Florence brings to us to the discussion years of personal and professional experience from the front line of the fight against HIV and leads on advocacy efforts around the globe on HIV and AIDS. UNAIDS is a joint program of 11 UN agencies where we bring our collective action to bear to bring multiple disciplines for best results. WHO plays a critical role in sustaining the response and is with us today. We're honored to have Dr. Jerome Salomon, who's the Assistant Director General, Universal Health Coverage, Communicable and Non-Communicable Diseases from the World Health Organization. Jerome, as you know, has extensive experience in health systems management, communicable diseases, and international public health. And we also know that it is absolutely critical to bring the knowledge of multi-sectoral and regional networks to bear. We have today with us Zuzu Sukazwe, who's the co-chair of the Africa HIV Control Working Group and also the Chief Executive Officer of the Center for Infectious Disease Research in Zambia, CIDRS. She has vast experience in HIV prevention, care, and treatment, and brings along a very strong research background on the continent. We're so privileged to have this esteemed panel with us today. And so to get us started, maybe I'll just kick off with a few questions. First to Florence. Community organizations and civil society are a central piece of a successful HIV response. What would you like to ask from the Global Fund, from Pepfar and UNAIDS as governments and from governments as we advance in discussions and plans for sustainability into the future? Florence.
Thank you. It's an honor to be here, and thank you so much. As I start, I would like to acknowledge that for me and many people living with HIV, the opportunity to even engage in this conversation with you all is an honor. It's a miracle that we are here, alive, because that was not the story of the epidemic before. But with consistent leadership from governments, from UNAIDS bringing together all multi-sectoral partners, and the global solidarity that we have seen carry this work over the years, the story of HIV, particularly for people living with HIV and our families, has transitioned significantly, and we are now to the point of a story of hope. The hope that we can end AIDS deaths and end new infections. So we know how to get there. And at the heart of all this has been the incredible work and contribution of communities and people living with HIV, who for many, many, many years have always been grounded in our work, principled around nothing for us without us. We have evolved into a first-of-a-kind demonstration of a community leadership that connects from the grassroots to the global community powerfully shaping the agenda of the HIV response from the localized level, implementing services, task shifting back then, now it's task sharing, engaging with you all to make sure that services reach people, even the hardest to reach, but also shaping policy, financing, implementing community-based services, and also community-led monitoring. So to your question about what do I ask? I think three things. That we think how to motivate and engage and continue the political goodwill and leadership of governments and the many leaders that have gotten us to this level. We've learned a lot, we've continued and continue to learn, but the leadership that has enabled the civic space that existed for our work to date is needed to get us to move forward. It is the leadership that got us through big and huge commitments like putting 15 million people on treatment and the 90 targets and the 95s. But we know our civic space continues to be threatened and we need that leadership now more than ever. Also, policymakers, researchers, and governments at country to global levels have always progressively expanded opportunities for our community and civil society engagement. You call us, you're open to our feedback on how to create better inclusive space. You bring innovation to how we can bring more voices to the table. We must continue this, but make sure that all voices are needed in this discussion and beyond. And third, but most importantly, our work at community cannot happen without resources. And usually we know every time we hear there's no money or there's a money problem, it is community that first gets dropped out. We are a critical partner here, and investing in community, we have proven, has led to a lot of incredible wins for the HIV response. And so therefore, investing in communities, and particularly in co-funding that will require us to institutionalize our work. I think as I conclude, I would like to say that there's an opportunity for us to dream some more, to think of the future, and to provide a future that many of us weren't given in our stories of HIV. There is hope now. There's an opportunity to dream. There's an opportunity to invest in research and development, get us a cure, get a vaccine, shape this story differently. Now is the start of this conversation. With everyone on board, we can get there. Thank you, and back to you.
Thank you so much, Florence. Really, really appreciated those heartfelt comments and leaving your last comment, particularly about the opportunity to dream. We shouldn't stop. It's taken us this far and we shouldn't stop now. Great. We'll move to Zuzu. Zuzu, let me turn to you. The Africa HIV Working Group is bringing incredible thinking together from across the continent of Africa and leadership together from across the continent of Africa. We'd like to hear your ideas for a sustained HIV response. How should we ensure convergence of different efforts in the process so that it enables a truly transformed and sustainable future for the HIV response? Zuzu.
Yeah, good afternoon, good morning, good evening, everybody. And Anjali, I have this one slide to help me with that response. And for starters, I want to thank everybody, Unaids, Global Fund, as well as Pepfar for this opportunity. I won't belabor the left side of my slide. I think that's the reason why we're having this discussion. We're all fully aware of the remarkable achievements and what we've done to get us here. And these must be applauded and leveraged to move us forward. We're also fully aware of the historical injustices, the missed opportunities, the power imbalances, and the funding mechanisms. Madam Winnie talked about who funds us and where that funding mechanism comes in, and the complex micro and macro dynamics that have got us to where we are today. We are also fully aware of the changes we seek and the strategies needed to get there. The question that the HCWG, the group that I'm representing today, is asking is how do we move past these hindering bureaucracies and sometimes rhetoric from our leaders and our global supporters, and yes, even excuses from ourselves as those living with HIV or most impacted by HIV, given the realization of where we are today and to move towards actualizing the Africa we want. So one of the things that the HCWG is really pushing for is demanding that our elected leaders and others really set the tone and lead. Can they set the agenda to transition us to the next phase of the response? Our continent is endowed with experts. I think Peter Sands said we do have the resources, but lack the political will for some countries. We have our lived experiences that can support how we navigate the complexities of multiple priorities, currently dealing with climate change and its effects, and what is needed to get us to having a more holistic approach. So we need to demand accountability from our leaders and questions that we should be asking. We're talking about universal health coverage, but does our universal health coverage also talk about insurance for HIV programming, for instance? What is happening to the resources and the monies that are being spent? How do we reduce wastage and inefficiencies? And for that, we demand collective leadership and governance and accountability. Also governance, accountability, and leadership over data, having data lead our responses. We demand for sovereignty over data and how we use it to plan for our policies. And in order to have data to inform us, we have to invest in African research and investigators. And we have to think about working with new partners that maybe we have not traditionally worked with. And importantly, how do we use this data to work towards tailoring responses that feed into the needs across the diversity of Africa? Because we're one continent, yes, but we're so diverse. We have different cultures and norms. So how do we tailor our responses to feed into what is needed? Again, this requires really strong leadership and accountability. And the the HIV Control Working Group is, again, stressing the fact that Florence raised. How do we let communities lead? How do we work towards a community-driven response and not a commodity-driven response? We appreciate that the commodities are there and that new ones are being developed that may be more efficacious, more cost-effective, and so on. But to whose benefit are we developing these resources or innovations for? Have we gone and worked with them to understand how we can innovate so that they are easily adapted and taken on to end the epidemic? All this feeds into ensuring that we have a very clear understanding of what HIV control is for the African continent and what long-term sustainability will look like. We want to be able to develop really clear metrics for accountability, for focused intervention, as well as leadership and transition roadmaps. Ultimately, this, we believe, will culminate in a sustained HIV response across the continent that we lead, but lead with solidarity of the global community, because clearly we cannot do it alone, and hopefully be able to do this for all people that are living here on the African continent. I will stop sharing my screen, and thank you so much for that, Anjali.
Terrific. Thank you. Thank you so much, Zuzu. And thank you for just the clear, specific actions that are required or that you would require to ensure that the response is sustained, led by Africans for Africans. Jerome, let me turn to you. Welcome. Let me turn to you with your background and with your the position that you have within Unaids, really looking across UHC and non-communicable and communicable diseases. How can we ensure the evolving HIV response helps strengthen not only the broader health system, but also other or future pandemics, like, for example, what's being discussed around the pandemic accord? And also, if you could reflect on how we should be thinking about integration in a manner that protects the HIV impacts.
Thank you. Thank you so much, dear Anjali, for a very relevant question. Let me start by setting the scene. Next week, ahead of the 77th World Health Assembly, the World Health Organization will launch a report documenting progress and gaps in the first 2 years of implementing the integrated global health sector strategies on HIV, viral hepatitis, and sexually transmitted infections 2022-2030. The latest data show that new infections and deaths across the 3 disease areas are not declining fast enough. HIV, viral hepatitis, and sexually transmitted infection result in 2.5 million deaths each year. And new data suggests that more people died from viral hepatitis-related causes in 22 as compared to 18. The report will describe that many of the indicators, including those shared across disease areas, are not on track to achieve 2025 and 2030 global targets. HIV incidence and HIV-related deaths are slowly declining. However, the rates of decline are insufficient to achieve the 2025 targets. Despite the widespread availability of antiretroviral therapy, there were 630,000 preventable HIV-related deaths in 22, many due to late engagement in care and structural barriers to service access. The report emphasizes what we are discussing today, that we need to simultaneously strengthen our responses and future-proof them through a clear focus on sustainability delivered within a universal healthcare framework. Many countries are already finding synergies between disease-specific efforts and primary healthcare approaches, which can improve person-centered delivery of HIV while focusing on multi-sectoral actions and community engagement, all important for sustainability. Yet, more can be done to secure political will and commitment and to strengthen programmatic and policy linkages. WHO has developed a guide on the convergence of HIV and primary healthcare that can help guide countries as they develop their HIV sustainability roadmaps. As we move forward, we need specific attention to key and vulnerable populations and fight stigma and discrimination within health services and systems. The WHO UNICEF operational framework for primary healthcare offers an important template from which we can build a comprehensive approach to sustainability. It describes 14 interrelated levers for action and investment, from political commitment and leadership to looking at services, commodities, health workforce, and digital technologies for health. Importantly, the framework encourages to look at the political and governance aspects of the response, alongside service delivery and systems integration opportunities. In doing so, we need the needs of diverse and key populations, the provision of health insurance packages that include HIV prevention and treatment, local manufacturing, and supply chain management, and most critically, community engagement in service delivery and monitoring are important considerations. Tools such as cross-programmatic efficiency analysis, health intervention, technology assessment, and ensuring that the most impactful and efficacious interventions are used will remain fundamental to sustainability planning. What is needed will be a comprehensive approach moving forward. Our challenge is not simply a funding challenge or a service organization challenge. We must analyze and deconstruct, where necessary, all aspects of the response to HIV. Lessons learned from delivering HIV care to people who are aging and who are receiving integrated communicable disease, non-communicable disease, or even mental health care should be reflected in planning sustainability. When we look at integration sustainability, we require a focus on both systems and services. A key principle for sustainability is that no one size fits all, as member states are diverse in their context and their readiness to take forward a sustainable HIV response. Each country must generate its vision and actions for sustainable responses based on a variety of factors, including epidemic control, fiscal space, and human resources, among others. At the same time, donors and partners will need to be able to allow alternatives to specific earmarked funding and define priorities that are well aligned with the sustainability vision and considering also the Lusaka agenda. In countries, WHO has much to offer with teams well-versed in UHC, health financing, primary care, and partnerships. So we are working with our WHO representatives to ensure we engage alongside all partners, including communities, in this work.
Thank you so much, Jerome. Really, really important reflections and work that WHO is doing under your leadership and across the globe. Really excited about the guidelines or the guidance that you said is going to be coming out next week, and all the work that's been happening on the convergence on HIV and how we should be thinking about integration from a bi-directional kind of way. Very, very important. Thank you. Let's now turn finally to Dr. Naimi. Your country, Namibia, has been focusing on sustainability and has been making tremendous progress in the HIV response, and again, has been focusing on sustainability and is advancing in the buildup of a stronger health system for a sustained HIV response. In your view, what are the key elements of a successful pathway towards HIV sustainability? Over to you.
Thank you, Anjali, and thank you for the background guidance from Winnie, Peter, and Mamadi, and to my fellow panelists, Florence, Jerome, and Susie. I'm always delighted to join this discussion on a topic which is really dear to my heart. It's amazing to witness the progress made across country day by day, the passion, the hope, as Florence has just clearly articulated, and the aspiration for the future. We are very hopeful, we are very passionate, we see a brighter future in terms of sustaining what country has achieved over so many years. So once again, thank you for this opportunity. Back to the element, as Jerome has stated, there is no one size fit all. It all depends on the country context. And some of what I'll be referring to, I would think you will consider it as a case study of Namibia, not necessarily what will work for each of the country. First and foremost is the leadership. In this case, the government of Namibia is taking the lead on the sustainability agenda discussion in the country from the highest political level. Hence, it is important to have the political will. In Namibia, the Office of the Prime Minister is the overall convener of the sustainability agenda, supported by the Ministry of Health to coordinate the different technical working group and discussion because of the subject matter expertise. The key element is to ensure that the sustainability agenda is country-led and it's tailored to the country context. The context of Namibia is that we have a public healthcare system based on the primary healthcare approach. And the government funds 60% of the national response. And this is the type of the context that we are talking about. Hence, our sustainability discussion is based on that context. Secondly, it is the vision and the goals. The government has set goals and have been facilitating a dialogue for months now, capitalizing on every available opportunity and platform to share a clear sustainability vision for all the stakeholders to follow and to be able to participate meaningfully in the discussion. This is also have been informing the discussion on external funding and strategy to ensure that already, even without a final sustainability roadmap, the funding discussion and strategy are aligned to the aspiration as per the vision. In addition, our key elements include the programmatic sustainability in terms of the epidemiological context and the desired result. Sustainability is not a destination. It's what we need to get there. And once we reach the desired results, how are we going to sustain them? We are prioritizing our discussion on the domestic health financing system and political will to support policies that are responsive to advance the sustainability agenda. We can't sustain the response in its current format, being disease siloed, specific. So among our priority, we are considering to strengthen the entire health service delivery system that is built on a strong primary healthcare foundation. We consider primary healthcare as a bedrock for the universal health coverage. In fact, for Namibia, as we consider the sustainability roadmap, we are looking at it as a tool that will propel the country to achieve the universal health coverage aspiration, where everyone, everywhere, have got access to quality essential health services that is integrated and well resourced, so they don't suffer financial hardship. This is what we consider as a human right-based approach, going beyond the siloed disease-specific ideology. The sustainability agenda also presents to us a great window of opportunity for health and financing system reform to strengthen primary healthcare, which will advance smart integration of HIV, TB, and surveillance activity within primary healthcare as a way to UAC. So we are prioritizing and paying attention to community system. And I can't emphasize more what Florence have already mentioned, that we need to revive and strengthen the community participation, including the civil society organization. Hence, in the case of Namibia, we have invested and developed a social contracting policy for health services. And we are now channeling our investment to ensure the implementation of this policy, which will allow government to use its own resources to contract the civil society organization to provide health services. We consider this value for money and a good investment, a good return on investment. However, also our sustainability agenda and pathway goes beyond HIV, TB, malaria, by ensuring that we address the pandemic preparedness and response, ensuring that the health system will be able to withstand any pandemic shock, so that we protect this investment, the investment that we have made in most of the African countries, where we have achieved good quality of life and life expectancy is under threat if we have not paid attention to pandemic preparedness as part of our sustainability pathway. In conclusion, for us, sustainability, integration, PAC, primary healthcare, and universal health coverage agenda are interconnected, intertwined, and no one can be achieved nor sustained without the other. So sustainability can't be built on non-existent system, public healthcare system, broken or non-functional, neither the siloed health system. So our pathway, it's really about health transformation agenda, transforming the approach to health financing, transforming our agenda for programmatic planning and policy system. There are several actions that we are doing in parallel. For example, we are revising our essential health service package, and we are reforming the community health program to allow the community health workers to be more equipped to do more and of good quality with better health outcome. So, Anjali, we really thank the Unaids for guidance on the HIV sustainability with the HIV sustainability primer. And we are excited about the recently released, the Sustainability Companion Guide, which is guiding us step by step and prompting us with those several assessment questions to make sure that as we finalize the sustainability map, sustainability roadmap, it is comprehensive and it is responsive. So we thank the Global Fund and Pepfar and all our bilateral and multilateral partners that are working side by side as we develop and embark upon this sustainability journey. Thank you.
Wonderful. Thank you so much, Naomi, and thank you for your leadership on all of these elements that you've defined so clearly that are essential for Namibia's pathway to sustaining the HIV response. Really, really insightful reflections and guidance, I think, for all of us to consider across other countries and other sectors as well as we're thinking about sustaining the HIV response. It was wonderful hearing from our panelists today. We have a little bit of time to open up for some questions from the audience. If you'd like to put your question in the chat, I see some coming in. I'll try and group a couple and then turn to the panel. I'm seeing a number of questions come in related to political sustainability. This is something that all of you mentioned in terms of how important political sustainability is in the response. Maybe if you can reflect, and I don't know, Naomi, but I would appreciate reflections from any of you, Zuzu, Florence as well. You know, how can we ensure that the level of political sustainability, Naomi, you mentioned the Prime Minister being fully engaged in the response in Namibia. How can we make sure that all countries have the highest level of political commitment to sustaining the HIV response, especially maybe in countries that don't have that political commitment? Who would like to respond to that?
I can take a first stab at this, Anjali.
Sure, go ahead, Zuzu, and then maybe Florence.
Right, based on some of the thinking from the HCWG. So essentially, it has to start at country level. How are we able to get the information out to our political leaders in terms of the importance of reigniting the discussion around HIV and bringing it back into the broader agenda? Because for the most part, you know, the thinking is HIV is over and done with. We have the drugs, people are taking them, they're suppressed, and it's not seen as a priority. And right now, countries are dealing with multiple priorities. And so being able to present country data and be able to show evidence how the continued epidemic sips across the broader health system, and how we can integrate services for HIV program in other health diseases and push the agenda in terms of primary health care and universal health coverage. I think it would take country activists and civil society and others, academia and scientists, being able to engage with country leaders and showing them that this still remains a priority that needs to be addressed.
Great, thanks, Zuzu. Florence, did you want to come in as well?
Yes, and I think just to add on to what Dr. Sikazwe has said is the incredible role that primarily community and civil society have always played in motivating and pushing our leaders to be able to keep motivated towards leadership and leading in the response. But I think for me now is, just as Dr. Nemi said, sustainability is not a destination, it's what we need to do to get there. What is the message? And I think that is the message that will get us all there. So we are not in an emergency. Where are we now? What then is the need? What is the thing we need to all, in a global solidarity way, move towards together? And then all of us as leaders, I see over 400 people on this call, get together and behind that message. So I think the message would be guided by these discussions, the country level, diverse realities of their data and science, the engagement with community, because the community also need to understand what is our message as people living with HIV. It goes beyond targets, it's about much broader things. And then we come together around one key message that takes us forward. Yeah.
Thank you so much, Florence. Really helpful perspectives. Dr. Naomi, over to you, please.
Thank you, Anjali. Just to add on what Florence and my other colleagues have said is we have the data, but how do we simplify this data to be absorbed by the political leadership who are non-health? How do we clearly state the work that we are doing on sustainability, that is not only a health agenda, it's an economic and development agenda? If we don't address these health issues, how will they affect the economy and the development agenda of the country? We really need an engagement and communication strategy to be able to communicate and engage at that level. If I will give a simple example, last week Namibia has received certification from WHO for being on the path to elimination of mother-to-child transmission of HIV and viral hepatitis. And this was received by the Prime Minister. This is really allowing that our leadership is part of this agenda, but we are not running to them when we are in need of resources. Thank you.
Thank you so much, Naomi. Really, really important perspectives that you all are raising actually around the need for us to be thinking beyond health as we think about sustaining the HIV response. And maybe I could just ask Jerome, if you're just a question for you, as you're with the leadership that you have at the World Health Organization and how important WHO is in all of this. Maybe if you could speak a little bit to the point that Naomi was just raising about how we bring health into the broader multi-sectoral agenda, because in order to sustain HIV, as Naomi said, we have to be able to speak to non-health players and non-health leaders that also play a critical role in sustaining the response. What's your perspective on that?
Thank you. That's a very interesting question, and congratulations, Naomi, because we are very proud of your country. So I think also benchmarking between countries and between ministers is very, very useful, because we are proud when we have, this path to elimination of vertical transmission, and then it's a very efficient way of showing the importance of, triple disease elimination and having an integrated approach of HIV, viral hepatitis, and STI. So the situation is very different, and it's changed a lot since 40 years. And as an activist since 35 years, I know that we need also strong examples, strong voices, strong ambassadors, sometimes people with lived experience, sometimes, people that want to insist on different aspects of the fight against the epidemic. And I know that speaking with ministers and speaking with governments need to choose the right approach. Sometimes it's about surveillance, sometimes it's about capacity building, sometimes it's about education and prevention, access to care, research, human rights, ability to see what's going on, and of course, PHC and UHC approach. So sometimes you have countries where communities are very strong. And of course, at WHO, it seems quite obvious that we have a top-down approach, which is absolutely wrong, because we need a bottom-up feedback coming from countries, but even from regions, and of course from different key actors. So it's absolutely not only healthcare workers, but some often very strong voices, and of course people coming from different sectors. So benchmarking is important, and also showing some interesting examples, because we are fighting this pandemic since 4 decades now. So we learned a lot, and I think we should insist on the heritage of this pandemic, because we really made huge progresses in terms of integration of communities, integration of all healthcare workers, PHC approach, UHC approach, how we exchange information and data with governments and with key stakeholders, and of course that's very important. And maybe we don't insist enough on what we learned, and especially I was very surprised that there was almost no link between all the organizations that we put in place with key actors everywhere, fighting HIV and the way we reacted against Mpox outbreaks. And really, the work and the reaction and the efficiency was absolutely based on communities, strong reactions of communities, local reactions, sharing information, pushing for test and prevention. So all what we learned is very, very efficient. And of course, we are trying to convince all actors about the impact of having this new multiple disease elimination approach. If you think about having a global integrated prevention of all sexually transmitted infections, that's very efficient. So you can convince also donors, funders, that having this integrated approach of HIV and being able to help all these patients with HIV, all these persons living with HIV in terms of aging, in terms of fighting and managing, NCDs, and of course, helping them in terms of mental health is the right approach. So it's not only HIV, it's being aware of well-being, aging population. So having a real integrated approach of well-being and long life, even with HIV, is something that we should really support strongly, because it's not only access to treatment, is having really a normal life.
Thank you. Thank you so much, Jerome. Really, really helpful perspectives for us to think about how it's not just health, but broader than health, and how we need to be thinking about that in the context of sustaining the HIV response. Regrettably, we're at time. In fact, we're 3 minutes over time. So if you all could just please join me virtually in giving this panel a fantastic round of applause for sharing your expertise, your perspectives from the areas from the sectors from which you sit. This has really been a powerful panel to hear how important everyone is in sustaining the HIV response, from government to civil society to regional framing and thinking to multilateral organizations. I'll close by just thanking everyone for joining us today, and with what Naomi mentioned, which is sustainability is not a destination, but it really is a journey that we're all on together. It's our responsibility to make sure that the gains that have been made are sustained into the future, and that we have the opportunity, as Florence said, we have the opportunity to dream. We should dream big and make this work for the people that we're serving. So I'll stop there and just thank everybody again for joining. And thanks to Winnie, Peter, and Mamadi for setting the stage for this panel discussion. Thank you.